Would more regulation of trans fats, smoking and alcohol, plus decent cycle routes and opportunities to grow food locally for the many, lead to a better future than, I wonder who he's getting at here, high-cost interventions in tertiary care settings for the few?
Well, I suspect he may have a position on a primary care trust having to buy services from the local commissioning hospital. If I give some thought to that, perhaps I'll illustrate that with a very fine presentation I heard recently from Hugh and Gray, one of our cardiologists here, who has a role in the Department of Health. And what he with some American modelling systems, he was able to demonstrate that there have been influences that have significantly affected the incidence of death from coronary heart disease. Because obviously smoking there's a reduction in the number of smokers, and we get used now to entering pubs that aren't now smoke-free. In addition, there's been concentration on fats and diet, and both of those have had very significant effects on reducing the incidence of coronary death. However, it's been almost completely offset by the rise in obesity, or as is current parlance, diabesity.
What do you mean by diabetes?
Diabesity is the combination of obesity and diabetes.
Right, very topical at the moment.
The tide, as some refer to it.
And we're talking about type 2 diabetes.
I think type 2 diabetes associated with obesity.